So it's my honor to introduce Councilman Bob Ferguson, who represents the 1st District. And I also wanted to add that he's been a real staunch supporter and advocate for North Shore, and we really appreciate your leadership. So please.
Thank you. Thanks very much for being here. I get the opportunity to go to a lot of events like this, ribbon cuttings, groundbreakings. It's a part of the job, as Dow knows and other elected officials know. And I have to say that of all the such events I've been to, this one really stands out, perhaps at the very top, for a lot of reasons. But the one that I want to share, besides what you've heard about how great this facility would be to serve folks in our community, the point I want to focus on is how close it came to not happening. And that's, in my mind, what separates out from so many other events like this I've been to. As you may recall, back I think in 2007 or so, there was a lot of talk of closing public health clinics throughout King County. And then about a year and a half ago, it actually was proposed in the county budget by a previous executive to close this facility. It actually was in the proposed budget. I can tell you that once something's in a proposed budget, it's awfully difficult to change that. Okay, you've got to persuade your colleagues, you've got to talk to folks like Dr. Fleming, Tom Trumpeter, get folks together and staff to decide, hey, how can we find the funds to make this work? And it was a real challenge to do that, but thanks to the work of folks like Dow, Carrie Chihawk, Dr. Fleming, we had a lot of conversations back in those weeks during the budget to find the funds to keep this clinic open. We weren't sure if that would last for more than 6 months or a year. We didn't know, and that's frankly where all you folks did the hard work. In a sense, really, the easy part was finding some funds to put in there to keep the clinic open. But that's just a line in a budget unless the people are behind it who can be creative, can have the conversations, can think outside the box and decide, how can we make this work for the long term? How can we sustain a facility like this that's so critical for the people in times of great budget challenges? And so my thanks go out to each and every one of you. You've played a role in doing that. In particular, Tom, Dr. Fleming, of course, were particularly critical in that. And I really thank you folks for seizing the opportunity that we're able to put in the budget to provide the life for the facility for another year, to decide how can we do it long term. And that was not easy. And this may be a model throughout the county for other facilities as well. It's frankly been the type of creative thinking we need in times of great budget challenges, to not just say, hey, you know what, it's easy to close the facility on a budget standpoint, let's close it, save the dollars. It's a lot more difficult to work together collaboratively with all your partners and think of a new strategy, a new way to accomplish your goals and save taxpayer dollars at the same time. So thanks to all of you. I really appreciate you being here. It's a great day. I can't tell you how exciting it is. One thing I should just mention is, as long as I've got Dr. Fleming here, is that I came on the county council 6 or 7 years ago. No expert in public health, okay? I'm just not. And I've learned a tremendous amount about the world of public health from Dr. Fleming. He's really been someone I've turned to get advice on public health. We don't always agree every time on every issue, but I know that he'll be thoughtful in his reasoning. He'll explain where he is, and as been mentioned before by Tom, he's a great partner. He wants to get to a positive outcome. He wants to get there, and that's frankly a little bit unusual sometimes to have a partner like that. So Dr. Fleming, really on behalf of the county, we really appreciate your leadership on behalf of the county, and Tom, of course, for you as well. Without your support and all the people who work for you, this great day wouldn't have happened. So thanks to all of you, we really appreciate it.